Hi, my name is Angel. Let us discuss today the dangers and risk of fish pedicures. It has been a new trend where people are traveling to different parts of the world, and they think it's a good thing to do on a vacation. Let's find out what are the dangers and risk of fish pedicures are. All right. So, what is a fish pedicure? First of all, fish pedicure involves dipping the feet into a basin of water filled with fish. This fish, Gora rufa, is a species of the fish, sometimes called doctorfish, eat the dead skin off the feet, revealing smooth callus-free skin and a cleaner-looking cuticles. The fish pedicures are very popular in Turkey, where they originated, and other Middle Eastern countries. Gara rufa fish are native to Middle East and Southeast Asian countries. All right. What is a fish pedicure? Let's find out more. They're allowed in certain places in the United States, right? The procedure became very popular because the fish can exfoliate and soften the feet in a non-painful way. The fish pedicure tickles but does not hurt. However, these pedicures pose both health and environmental risk and are banned in many U.S. states and parts of Canada and Europe. So let's find out what's the risk of sanitation and health concern. When pedicure tubs are full of fish, they can't be sufficiently disinfected between customers, and there is no way to sanitize the animals themselves. Sufferers of contagious conditions such as nail fungus and athlete's foot often seek out fish pedicures, right? So you also have to understand what kind of people are seeking out fish pedicures because they're usually marketed as, solution to psoriasis, right? Fishes are animals, which means that they make waste, and that waste collects in pedicure tubs. That includes the waste from their body, fecal matter, other forms of defecation, etc. If you want a nice, smooth, even exfoliation, all you need is a pumice stone, right? Fish are nail technicians. They are not manicures and pedicures. That's not what they do. They have no way of knowing what areas you would prefer for them to focus on, right? So they can bite you at any place on your feet, your soles, your nails, your cuticles, area where you may have stem cells on your nail beds, etc. People who purchase these pedicures have reported bumpy, uneven skin and areas that were bitten deep enough to draw blood, right? Because most of the fishes are very hungry. They're not fed properly, and this is exactly why they eat dead skin. Why? They haven't given any food. That's what. Fish pedicure tubs provide a fertile breeding ground for bacteria, and even tiny cuts or sores can become infected when immersed in them, right? So if you have a tiny cut, you have a sore on your foot, which most of them do, chances are their psoriasis is so bad, their fungal infection is so bad, they're actually asking for the fish to eat them, so they can be released of their itchiness, the pain, the swelling, the redness, etc. The Gara rufa fish themselves have been found to carry strains of several infection causing bacteria including Streptococcus, agalactiae, which can also cause pneumonia, and others that are resistant to antibiotics, right? So once you are infected with a bacterial infection, let's say strepto or any other form of infection, chances are it can be so dangerous that even antibiotics cannot help you. Gara rufa will only eat dead skin if they are starving, so the fish are not given other food, right? So they will only eat dead skin if they are starving. That's what it is. That's the whole mechanism is. If they're hungry, they'll eat your dead skin from your feet and or your body. Sometimes tourists are also, lured into getting a full body fish pedicure, like a full body fish ichthyotherapy. That's what they call it, ichthyotherapy. Bacterial infections caused by fish pedicure is fish used in fish pedicure can carry bacteria like Aeromonas, Vibrio cholerae, Chivanella putrefacia, Mycobacterium marinum, and Mycobacterium gudi. This bacteria can cause infections in humans. As you can see, this is the infected foot. Mycobacterium marinum is the name of the bacteria infection. Name of the bacteria. A previously healthy 21-year-old male patient presented at the dermatology department due to an asymptomatic hard, rough brownish erythematous plaque on the dorsum of his left foot. extending into a circular lesion that had developed during the past 4 weeks after a public fish pedicure in Bangkok, Thailand. The patient did not immerse his feet in the sea or in any other water during this holiday. Local treatment with corticosteroids was used twice daily for 2 weeks before his presentation. So even after he used corticosteroids, chances are it got really bad. And because it's circular, chances are it will keep spreading on his foot. In the worst case scenario, spread all over the body slowly and gradually. It will be very hard, for this person to get rid of it. So before you get a fish pedicure, think twice because you'll end up, with a foot like that. Bloodborne diseases can be spread through fish pedicure as well. If someone with an open cut bleeds into the basin, there is a small risk of passing bloodborne diseases like HIV or hepatitis to other customers, right? And most of the symptoms are actually mimicking regular psoriasis or acute psoriasis, So even if the fish pedicure salon is careful to ask their clients, chances are they will never do it because they're only in it for the money, right? They're trying to lure the tourists, because chances are they'll never see each other again. So as you can see, most of the feet are mimicking the symptoms of acute psoriasis. Chances are, even if they will be like, oh, I have psoriasis, can you please ask your fishes to eat my dead skin on my foot? Chances are the person may be suffering from acral target lesions, or they may be suffering from some sort of inflammatory dermatosis or Kaposis sarcoma, and the person has absolutely no idea that he may have HIV, and then these are nothing but just the symptoms of it. So before you get a fish pedicure, think twice. Okay. Trauma to toenails. The pressure of the fish can cause trauma to toenails, which can lead to blackening and falling off. This is known as onycholysis. The fish used in fish pedicures, Gora rufa, are sometimes confused with chinchin fish. Now, chinchin fish have teeth. Gora rufa does not have teeth, but most of these breeders are not very educated. It's not like they have a degree in marine biology. They're not marine farmers. They may just buy the fishes from a local vendor or a broker, and chances are they have no idea it's mixed with different breed like chinchin or any other form of breed, which can actually bite you and increase the risk of infection. Yeah, this is exactly why most of the patients have shown with uneven and bumpy feet. Why? Because at times fishes may eat a lot of many parts of your foot unevenly, so that may happen. Or they would eat more of toenails. Why? Because you have more dead skin under the toenails. Onycholysis is a condition in which the nail separates from the skin beneath it. It may be caused by nail injury, fungus, or psoriasis. The condition does not go away, and you must wait until a new nail grows in, right? So this condition is not going to go away. What you have to do is just take off the toe and wait for the new toe to grow in, which will not only be very damaging to the look and feel of your feet, but it is also going to cause a lot of harm to your feet, because nails are actually protecting the tip of your toe. Imagine something falling on the tip of your toe, and it may cause injuries and more infections, more cuts, more sores, and God forbids, if you have been infected by some kind of bacterial infection, you may have to either take antibiotics, and at times it may not work, and you may have to remove the toe. So think twice, okay? Staphylococcus aureus infections on the feet occur when bacteria enter the foot through a cut, scrape, or wound in the skin. So let's say if you have a cut, scrape, wound in the skin, at times some patients are diabetic, and they may not even know that I'm having a cut or scrape or wound or a wart infection, and they have absolutely no idea, and they go for a pedicure, a fish pedicure, and chances are they may get the Staphylococcus aureus infection. Staphylococcus aureus infection is also very common with swimming pool decks and people that use the same. However, the water is chlorinated, so chances are very less. The likelihood of you getting infected with Staphylococcus aureus is less, because most of the swimming pools have chlorinated water, which kills the bacteria. Aeromonas, sobria, superficial necrotic bullous dermatitis. Okay, so fish pedicure induced Aeromonas Aeromonas sobria, superficial necrotic bullous dermatitis in a patient previously undiagnosed diabetic patient. So this is already a diabetic patient, but undiagnosed with Aeromonas sobria. Aeromonas sobria, superficial necrotic bullous dermatitis, is a skin condition that can occur after exposure to Aeromonas sobria bacteria, which can be found in a fish tank water. So this bacteria already exists in the fish tank water. All right. Fish pedicures, also known as fish baths, fish therapy, or ichthyotherapy, can be source of Aeromonas sobria infection because the heated water in the tanks can promote bacterial growth and increase skin porosity, which means the bacteria can actually penetrate your skin. Your skin is actually a very strong and anatomical barrier of your immune system. However, if it's warm, chances are it will permeate and it will cause infection. Okay, so this infection is superficial, but I have also seen cases where the bacterial infection would be so deep that the patient would have a bone disease, osteocytosis. So uh, think twice before you get fish pedicure. Woman loses 5 toes after infected Thai fish tank at spa leaves her with horrific injuries, right? The tank she put her feet in contained a waterborne disease only found in Thailand. So it is not found, because rufa fish is native to southeastern and middle eastern countries. You cannot find them in North America, Central America, right? So there you go. It was only found in Thailand. Chances are, even if you get any kind of treatment in United States, the podiatrists, the doctors would have absolutely no idea what it is, and they may not know how to treat it because you may be the first case in the country. The only option they may have is to remove the limbs, okay, or remove the toes, or remove the infected part from your body. Fever and sickness took over as she ended up getting another bone infection in her big toe, all right? So fever and sickness took over as she ended up getting another bone infection, right? So uh, a big toe infection can also be passed to the second toe, the third toe, and then the small toe. And each and every toe will have to be removed. Why? Because our toes are a very important part of our foot to balance our body, right? That's why when kids are born, they walk on tippy toes, and at times we walk on tippy toes, and they actually provide a lot of support to the body. So if you chop off the big toe, chances are the rest of the toes will be impacted because now they are carrying the weight of most of your left or right side of the body, right? In the end, even if you keep one toe because that's not infected, chances are you'll have to remove that too, because now you'll have to wear like an orthotic in the front. So after you wear your shoes, you can stand firmly, but that can also cause some serious infections in the future. Why? Because you're wearing warm and moist shoes all the time, right? Because you'll have to walk, you'll have to go out and hang out with your friends and family. That can cause some serious infections, for example, an athlete's foot. So somewhere I feel the fish pedicures are actually not worth the risk that you're taking. Not at all the risk. Or not at all worth the risk that you're taking. Many spas will simply reuse the fish. They're not going to go ahead and buy new fishes every day. European test conducted. It was a doctor, a scientist who conducted the test, in 2011 of imported Gara rufa fish, which unearthed the bacterial strain Streptococcus agalactiae group B. This bacteria can cause pneumonia, bone and joint infection, and bloodstream infections. All right. So Dr. Keita Paul, that's what they actually conducted a research, and that's what they found. So pneumonia, they can cause bone. All right. Let's not forget that it can also cause bone marrow issues, which can actually lead to cancerous growths in the body. All right. And also the joint infection. Okay, joint and ankle. So you have to be careful when you go out. As you can see, this foot is, this has dark presentation, swollen presentation. We also see a little bit of onycholysis, because as you can see, the toe has to be removed. Look at all the nails that are damaged. This blackened area is a sign of severe bacterial infection. I would not be surprised if she's already pre-diabetic. And as you can see, the redness and the swollen area here shows that there is inflammation causing some sort of edema, right? Immunocompromised in diabetic patients. Some groups are at high risk of infection from fish pedicures, including people with diabetes or compromised immune systems, or people with breaks in the skin, right? So if you have one cut in the skin, most of the time diabetic patients don't really know that, they have cut, because nobody actually takes a mirror and looks underneath the feet. It just never happens, right? So on day 1, you have a little bit of redness. On day 2, as you can see, there's a little darkening. On day 3, you can actually see the yellow pus that's coming out. On day 4, it's really acute. On day 5, it's darkened. What it kind of means that the blood's getting clotted. The body's immune system is actually working. It also means there is a little bit of blackened necrosis that's going on. As you can see, that this is all necrotic. It's all necrotic, and this is like real-time necrotic, where the necrosis is not just superficial, it's going underneath the muscles, the tissues, the fascia, the muscle layers, etc. Okay, and now this person is fully healed, and this is how his foot looks. But you have to realize there was a cut here where they actually stitched it, but then they also had to remove this part of his foot skin. Chances are they may also have used a graft here. Okay, so alright, so athlete's foot fungal infection is also very common. Like I said, health issues of users. People with contagious conditions such as nail fungus, athlete's foot often seek out fish pedicures. Alright, so there is more chance for infection to spread. Alright, so before you go to a fish pedicure spa, understand the type of people that may be using it. The ones with blisters and cuts and wounds. Already, as you can see, this is chronic athlete's foot. This is really acute, really bad athlete's foot. People like them will be using, fish pedicures, and chances are very high that it will be transferred to. As you can see, there's a little bit of tinea pedis, yellow nails, and as you can see, the skin's coming out. This is really acute, okay? And the fishes will be eating them and maybe defecating them, and you're putting your feet in the same tank. It's dangerous. Alright, fish pedicures, this trend is more than a little fishy, right? We've actually figured it out, right? Therefore, when you immerse your feet into a fish spa, you're bathing in water contaminated by other people's germs. And think about the type of people likely to want a fish pedicure. Those with fungal infections such as athlete's foot, verrucous, which is warts, blisters, and dry skin. You need to ask yourself, do you really want to dip your toes into that water? Okay. Alright, so I hope I helped you. If next time you travel to Turkey, you travel to Thailand, Bangkok, Indonesia, Vietnam, I don't care, or maybe in the United States, there are certain parts of the United States that have legal fish pedicures, but I would suggest you please do not use them. Alright, I wonder why they're even doing it, because most of the fishes are very starved, and these fishes are not native to America. They are from a different part of the country. I just feel it's unfair to the fishes that you're bringing a non-native fish and asking the fish to survive in a tank. Okay, most of them may even die on their way to America because they do not belong in this environment. Alright, so I hope this helped. Please be careful. If you really want to get a pedicure, use Epsom salt at home. Use a little bit of lukewarm water and scrub the foot, the stratum corneum, the pad, the heel pads, and the crunchy layers of dry feet with a pumice stone, and that will help you. If not, use a moisturizing lotion that would donate moisture to your skin. Like, if you don't have anything, just use Vaseline and cover it, with a silicone foot bag, and then go to sleep. That will help you. Okay, bye.